Recruiters calling or texting you nonstop? Want to find the right job without exposing your personal info? Need tools to manage your search all for free? In every industry, there comes a moment when innovation challenges the status quo, ushering in a new era of possibilities. Beginly gets it. They get us. Their platform anonymously matches you with jobs that suit you until you decide to share your info. Customize your job search based on economic factors like salary or cost of living, or non-economic factors like location or nearby stadiums or airports. And their algorithm does the rest, all for free. Ready to find your perfect job? Visit beginlyhealth.com/doctoring. Powered by preference, connected by passion. Did you know that the great feeling you get from cleaning your ears is called an eargasm? I don't recommend cleaning your ears, and you'll find out why soon. Or did you know that your diet doesn't influence the color or texture of your wax? Now, one of those things is true, and the other one is kind of made up. Stay tuned for more interesting information about earwax. Hey, this is Brad Block, host of The Physician's Guide to Doctoring. This is a personal and professional development podcast for physicians where we have experts on the show that try to teach us everything we should have been learning while we were memorizing Krebs cycle. Welcome to Earwax. So we have a new Physician's Guide to Doctoring Facebook group. It's a great way for you guys to give me suggestions for episodes like this. I'm going to put up who I'm interviewing or what subjects I'm going to be interviewing about. So if you guys have specific questions for those people or on those topics, great way to interact with me so you get those questions answered. I've been getting a lot of great feedback from you. And one of the topics that one of you guys wanted to hear about is more specialty specific. Like what do different specialists think every doctor should know about their specialty, right? After you've been in practice for a while, you end up seeing the same things over and over. And it would be great if all your referring doctors just knew this. Community members, right? Like we're going to be talking about earwax. Who knows? You might be a neuroradiologist and someone happens to ask you a question about earwax at a cocktail party. Now, I don't know if I want to go to that cocktail party, but you know what I mean? People just ask you, hey, can you look at this rash, right? That type of a thing, just because you're a doctor, even though it has nothing to do with your specialty. So make sure you check out the Facebook group, be a member. I'd love to hear from you. I'd love to get feedback on what ideas you have and what you want to hear about. Be a great way to get what you want out of the podcast. And so again, what someone specifically asked was more specialist, what they want people to know. And being a specialist, I get asked a lot about the exciting topic of earwax. In fact, I taught a class on it, a local school for audiologists on earwax. Yes, a whole class. They gave me so many hours. I didn't know how I could possibly fill it all about earwax, but I did what I could. And I learned a bit myself. So let's get right into it. What is earwax? It's a skin oil. Like you have oil on your skin. And one of the functions of it is to help the skin to be a more effective barrier. And so it's a skin oil. It's just a more viscous skin oil. It's wax. It's a lipid. It's an oil, just more viscous. And yes, there are variations in the type of wax that people produce. And these are regional variations. People from Europe and Africa tend to produce more oily, greasy wax. And people from East and South Asia tend to produce more dry wax. Now, it's not a rule, but it's very common to produce different types of wax if you can trace your lineage back to these places or from these places. But that's the function of wax. It's an oil and it's a secretion, not an excretion. And so that means it's supposed to be there. And what I tell all my patients is the same thing. The body has a system for making wax and pushing it out. It does. And it usually works. Sometimes it doesn't. In the same way that the body has a system for making poop, feces, and pushing it out. In the same way that people can become constipated, people can become earstipated, and it gets stuck. So if the system breaks down and doesn't work as it should, it can break down. And then, yes, you get a wax impaction. Now, how does that system work? Interestingly, chewing. So the inferior border of the ear canal is your temporomandibular joint, which is why one of the most common causes of ear pain is TMJ. So if you're in primary care, urgent care, emergency medicine, patient comes in with ear pain, you look in the ear, it really looks pretty normal to you, or you're not quite sure, right? Because sometimes, listen, the ear exam's tough. The ear exam is tough. I don't get it right 100% of the time, but I have audiologists that I work with and tympanometry that can help me double check my work. Always look for TMJ. So push on the TMJ. You can either stick your finger in their ear canal, have them open and close their mouth a couple of times and see if there's point tenderness over the TMJ, or check for habits. Look and see, you can see wear facets on their teeth from where they grind. If they do brucks, maybe they chew a lot of gum, maybe they bite their nails, maybe they have some habit that would make them more susceptible to TMJ, or maybe they don't. But push on the TMJ if you can't find another source of ear pain. That being said, a more ominous source of ear pain could be like base of tongue cancer. So you really need to take this stuff seriously and make sure they have follow-up with an otolaryngologist if you can't otherwise figure it out. But definitely make sure that TMJ is on your radar. Now, I know I've gotten off on a tangent. We're supposed to be talking about wax, but it's important information, and I promise I'll be bringing it back. So the way that your body gets rid of the wax is through the wiggling of the canal skin from chewing. So when you chew, it wiggles the skin so that wax can kind of march its way out. Okay, so what are some reasons why someone might develop a wax impaction? It could be Q-tipping. Could be Q-tipping, right? Yes, Q-tips are my nemesis. I have other nemesis, like people that don't get their HPV vaccines and make themselves and other people more susceptible to tonsil and base of tongue cancer, as well as cervical cancer, anal cancer, penile cancer, all those HPV preventable cancers, right? Those are my nemesis. But Q-tips also my nemesis. Why? What problems can Q-tips cause? Well, one of the things, you can do a fantastic job of cleaning your ear. You do a fantastic job of cleaning out your ear. So now your ear canal is completely clear of wax, which makes the canal skin dry. And dry skin is itchy. Dry skin is itchy. So now you've got itchy ears because you've done such a good job with the Q-tips that you strip away all the wax and your canal skin is dry. So what other problems can Q-tips cause? Yes, you can smush the wax in. You can lose the end of the Q-tip in the ear canal. I've seen that quite a few times, and I'm going to go fishing for it. Another problem that Q-tips can cause is you can scratch the canal. Scratch the canal, you end up with a bleeding ear. A bleeding ear can be pretty scary, and you can rupture the TM. I've seen it a couple of times. I haven't seen it that many times because the tympanic membrane is further in there than some people realize. You got to get that. It's going to get uncomfortable before you've gotten far enough to actually rupture the TM, and then you're going to pull your hand back. But, I've seen some people where the door has opened or they've fallen or some surprising trauma has happened. And actually, if that happens, you can even damage the ossicles and end up with permanent hearing loss. So a bunch of reasons not to use Q-tips, right? Stripping the canal skin, making the skin itchy, pushing the wax in, rupturing the TM, scraping the canal. Leading a medical practice is challenging. There can be reimbursement changes, referral slowdowns, staff turnover, or drama. There are obstacles in the way of achieving your goals, or maybe it feels like you've hit a plateau. Who can you turn to for help with the business of managing a medical practice? The Physician Growth Accelerator, a private practice partner that helps you uncover and overcome constraints in your practice. They will check your business vitals, identify the root cause of what's restricting your growth, prescribe what to do about it, and help you achieve it, just like we do with our patients. Imagine your practice, where stress is reduced, profits increase, and both patients and staff, and you are happier. They've been making that vision a reality for over a decade. Isn't it time your practice thrived? Discover how at physiciangrowthaccelerator.com. The other thing is, if you do such a good job of cleaning out your ears that you've stripped away all the wax, well, what was the function of that wax? The wax is a waterproofing agent for the canal skin. So now, take a shower, you go swimming, the skin is going to absorb some of that water, and it's going to start to break down. And now you've got a swimmer's ear, a bacterial infection, sometimes a fungal infection, of the ear canal skin. And so the thing that made you susceptible wasn't the swimming, because really, the wax should make it so you can go swimming. Now, some people's ears are a little more sensitive. Maybe they need earplugs or some type of ear protection if they go swimming pretty regularly. But for most people, for the most part, your ears should protect themselves with that wax unless you strip it away. So the thing that made them susceptible wasn't the swimming, but rather the Q-tipping. Now, some people will say, no, I don't use Q-tips, or I don't go that far in. And the answer is, listen, if you can't reach it with your finger, then you are too far in. If you're worried about the auricle, the pinna, yeah, sure. Soapy water, clean that with your fingers, but like, don't try and stick anything in the ear at all, even close. It's just not necessary. And this is one of the things I say to my patients over and over. My refrain is clean your ear like you clean your bottom. Wipe the outside, but don't stick anything on the inside. Simple enough, because your body is a system for cleaning that. Body is a system for pushing out poop, right? Cleaning the colon, cleaning the rectum. So you just wipe the outside, but nobody's sitting on the toilet going, I wonder, there's more poop. It's inside there, further in. Let me put a Q-tip in there, clean it out. No, nobody's doing that, yet they're doing that with their ears. I guess that people can see your ears. They can't really see your rectum very regularly, but I digress. Okay, so now we know why we're not supposed to use Q-tips. And the other thing is sometimes people will make a makeshift Q-tip. They'll, oh no, I just use a towel. I just use a paper towel. I just use a tissue because they think the Q-tip is the problem. But no, the Q-tip isn't the problem. The cleaning is the problem. Okay, so that's one reason why someone might get a wax impaction. Another reason they might get a wax impaction is if they have some eczematous changes to their canal skin. So it's like eczema. So they have a lot of dry, flaky skin. Now, the body, again, has a system that it's evolved for making wax and pushing out. But if this system doesn't work quite right, it might not work. And so when you've got a lot of dead skin mixing with the wax, it's going to form a harder impaction. It's going to form a harder, piece of wax than it normally would. And then it can't push it out. So now you've got a pretty hard impaction and then it needs to be removed. So if you have eczematous canal skin changes, and then in that situation, how do you prevent it in the future? Well, you treat the underlying problem. You treat the eczema in any way that you would. And, as long as there's no hole in your eardrum, the ear canal is lined with keratinizing squamous epithelium. Even the top layer of the eardrum is keratinizing the lateral portion of the eardrum is keratinizing squamous epithelium. It's really, as long as there's no hole in the drum, you can put like a normal skin cream in the ear. Just don't gob it up to the point where they, can't hear. And now you've got to come in to have your ear clean. Okay, so that's another reason why. So you might have some eczema, you might have Q-tips, other things. It might just be the shape of your canal. You might have a particularly curvy canal or a particularly narrow canal. The narrow canal is not necessarily a problem because you can't push the wax out, but it just requires less wax to plug up the canal. Might be because you use hearing aids. I mean, hearing aids, the more occlusive it is, the harder it is for the body to push the wax out. Because what have you done? You've put a piece of plastic in the way. That's prevented that. Now, I'm not telling you not to use hearing aids. If you need hearing aids, absolutely use hearing aids. There's tons of reasons why you need to use hearing aids. Won't get into that in this episode, but please use your hearing aids. But that person might need to have their ears cleaned every so often. And then the question is, well, how do we do it? So you've got some wax in the way, right? How are you going to get it out? So we have a couple of tools as an ear, nose, and throat doctor. We have a couple of tools at our disposal. One thing that we have that other people don't is binocular microscopy. So we have depth perception. We can use a microscope with two eyes. So we're able to see how far we are in the ear canal to make sure that we don't get anywhere near the TM, where other people don't have that available to them, right? In primary care or urgent care type setting. We'll use curettes, right? To scoop around the wax. We'll use suctions. Just make sure you don't use the suction in there for too long because it is pretty loud and it can potentially cause some noise damage or at least give them a sense of fullness for a while. Sometimes we'll use irrigation. So something that I use, and it works well for foreign bodies as well, is I'll take a 60cc syringe and get an angiocath, like a 20 gauge angiocath, and that'll, create a little jet. Now, when you're irrigating at the ear canal, you want to make sure that whatever you put in the ear is not sealing the canal, because then you push the pressure in there and you're going to rupture the TM. So make sure that there's plenty of room for outflow. And what happens is that water can build up kind of behind the wax and push it out, or behind the foreign body and push it out. It's a great way to get a foreign body out of the ear in an atraumatic way. So make sure that the water is as close as you can to body temperature, because if it's too warm or too cold, you're going to give your patient a caloric, which means you're going to give them dizziness. You're going to give them vertigo, right? You're going to stimulate their semicircular canal and you're going to give them vertigo. So make sure that it's not too warm, not too cold, as close as you can to body temperature. And if they do start to get dizzy, stop. If they've had a mastoidectomy, don't do that. Don't put peroxide in their ear. Don't put anything in their ear. Please, if they've had a mastoidectomy, leave that to us because their canal is different. Their semicircular canals are super close to where you're going to be doing this. And a mastoid debridement is dramatically different from just a plain cerumen removal. So if they have a history of mastoidectomy, that should be taken care of by an otolaryngologist who's probably not listening to this lecture because they could give this lecture themselves. So other ways that we'll get wax. So curette, suction, irrigation. We have like little forceps. If it's hard enough and it'll stay as one lump sum, you can use forceps, although a lot of times it'll look that way and then you grab it and it falls apart. So that's the different ways that we clean it. Other things that you can use, interestingly, Colace, stool softener, and wax softener, peroxide. You can have patients use it at home for a couple of days to soften it up. You have them use Debrox, which is carbamide peroxide, which is a little more viscous than water, than hydrogen peroxide, so it stays in there longer. All these, you got to make sure that they don't have a prior history of a tympanic membrane perforation, so none of this stuff goes through into the middle ear where it's not supposed to be. You can have them break down the wax for a couple of days with some wax removal drops, and then have them come back, and then it should clean out a little more easily, especially if you use that irrigation technique. Or, send them to their friendly neighborhood otolaryngologist. I think that's it for earwax. That's quite a bit. That's probably more than you ever wanted to know, but all of those questions that you wanted to have answered about earwax, now you know. Dr. Danielle, gastroenterologist extraordinaire, thank you for the suggestion for having more specialists on the show. I hope you found it interesting. Make sure you tell all of your friends about this podcast and how amazing it is, because I'd love to be able to share my knowledge or the knowledge of the experts that I have on the show with more people. Check it out on Instagram, on all the social media, on all the socials. Please interact with me. I want to know what you want to know, what you want to hear about, and who you want to hear it from, so I can be sure I get them on the show. And of course, share, like, and leave a nice review. Being contacted by recruiters can be a lot. I've been at the same job for over 12 years and I still get texts and emails, sometimes in the middle of the night. Instead, get matched anonymously to find your right job. Beginly Health is a dating app for your career. To swipe right on your career, visit beginlyhealth.com/doctoring. Powered by preference, connected by passion. Thanks for listening. I have a favor to ask. You listened to the episode until the end, which means you either fell asleep or you really liked the episode. So please share it or like it or comment on a social media post or write us a 5-star review, something. It would really help me out. And maybe what you learned from this episode can help someone else too. The views expressed in this episode are those of the interviewer and interviewee and don't represent the views of their employer or even their significant other. Even though the magic of podcasting make it sound like I'm talking directly to you. This is not a doctor-patient relationship, and this is not medical advice, or financial advice, or really any advice. Thanks again for listening to The Physician's Guide to Doctoring.